This is Dr. Eric Fishman for EHR TV, and we have the pleasure today of speaking with Ryan Howard, CEO of Practice Fusion. And Ryan, I thank you for taking the time today. I really appreciate it. As you know, but maybe some of our viewers don't know, Practice Fusion is the leader, the only meaningful, if I can use that word, free electronic health record. And Ryan, let's start with how you got the idea, and then we'll talk a little bit about the product itself.
So I got the idea from, I had worked with Brown & Tillman, one of the largest physician groups in California, and when I worked with them, I learned a lot about how small doctors in the marketplace are capitalized, the makeup of their practice, their IT aptitude,
or lack thereof.
Exactly, and just I understood that they were cash constrained. They had no IT resources. We saw that a lot of nurses were running the IT in the offices, and then I realized that beyond just serving them an application over the web, they also needed. Their needs were much more complex than most users. So there's really two pieces of magic to the product. One is the cost. We found that the doctors were just totally cash constrained. We actually used to give the product away and charge for support, and we still even had to manage that. It became difficult, so we ended up going to a totally free model. We found other ways to subsidize it. And then beyond that, we also wanted to eliminate the complexity from the doctor as well. So that was to keep going on that point. There's a tremendous amount of complexity in the back end for a physician to do his job effectively. So to order and receive labs, to order and receive prescriptions and receive refills, to share a patient record, and that's a great example. It's where does that record live, who owns it, how is it synchronized between doctors.
And so cloud computing is a phrase I've heard all day long, today, yesterday, the day before.
Absolutely.
It is where we are now.
It inherently solves many of these issues, and granted we kind of had to start from scratch and create this well, no one's ever done it in the past, but that's why we have the volume and velocity that we do today.
And jumping ahead, and we'll come back, I understand that there have been over 30,000 physicians enrolled to use the software so far.
Yes, we just reached the 30,000 mark. We're ramping on about 1,000 users a week now, so our momentum is tremendous. We're outpacing all of our major public competitors.
That's an unheard of number. So tell me the revenue model, since free doesn't last forever unless you have unlimited funds and you're doing it as a philanthropic effort, which I think may not be the case.
Absolutely. So on the back end, we have ways that we monetize, but it's not through the physician ever. So just to be clear, the free model includes licensing, training, hosting, and support. So the entire gamut. There's never any charge to the doctor. It's not freemium where they take the product in after they add a 10th user, they get charged, or to use a certain part of the product, they get charged. It is totally free.
And just let me interrupt, I do a number of services for physicians, and as you probably know, I'm an orthopedic surgeon. I feel abused by the insurance company, by all parties, and I've had a lot of pressure encouraging me to charge physicians for many of the services that we do for physicians, and I just said, no, I won't do it.
Yeah.
And so I commend you on that.
Yeah, absolutely. And so the model is twofold. We actually, there's some advertising on the product. It's small, it's discreet, there's no pop-ups.
Is it Google specifically?
It's not Google, no.
Had it ever been Google?
Yes, it had been Google at one point. It's mainly just other service offerings, maybe billing services or things like that. And just people who want to reach doctors. And beyond that, we also work with the data to some extent, but we're not selling that today, but we probably will at some point. If we ever do, it'll be fully HIPAA compliant, de-identified, anonymous. Again, the integrity and the security of the model is really one of our top priorities.
So talk about the data security and issues of that nature and the features.
So on the data side, for the technology, on the technology side, we're based in the cloud. So when you look at another EMR, even if you install that yourself, you're going to have, as a physician, different levels of security that you need to comply to, and you're going to have to manage the protocols. And what we have in place is we have data is encrypted at rest, data is encrypted in transit. We have Cisco firewalls, there's redundancy, mirrored backups, we're co-located. And so all these things add up to a level of service of a Fortune 500 company. For a doctor to do this with another EMR, they could purchase the EMR and pay that upfront license, and that would be significant. But beyond that, they would also have to run all that infrastructure in their office. Exactly. I mean, I don't even believe they could do it in same business.
Now, many people may not know about your history. You work with CNET, and you've got Salesforce.com, obviously a substantial company, as one of the investors in Practice.
Well, I personally work for the founder of CNET, Halsey Minor, and Halsey was. Again, the founder of CNET, he also founded Grand Central. He was one of the largest individual investors in Salesforce.com. Really an on-demand pioneer. And I also, the company Practice Fusion has an investment and a technology partnership from Salesforce.com. So obviously, you know, they're an on-demand pioneer. They have one of the largest, when you think about it, they have one of the largest cloud-based enterprise or software as a service enterprise communities in the world. They have about 1 million users, and so they really understand a lot about getting users rapidly on a platform, and we've had the benefit of their experience.
Seems to be working. What do you see as the future for the next 12 months?
I think the future is, I think, you know, by the end of the year, we'll probably break in about 100,000 users. I think the future of the product is really a feature we have coming out in the next 2 months called Chart Share, and what it does is that, we spoke earlier about HL7 being a dirty word, for example.
Not a dirty word, but complicated.
Complicated. I do think it's a dirty word, and why I say that is that you have electricity, right? So you go home and you plug your laptop and power automatically comes to it, but you don't know where your power grid is, right, or your converter box, so it's something that they just don't need to know about. You know, you don't manage the infrastructure of the power station at your house, and it's really the same concept. So what we're doing, we already take care of a lot of that complex interoperability and connectivity in the back end. We're taking it to the next level, that of sharing data in real time with other doctors. And when you look at our business model, because it's free to the doctor and because it's web-based, we will have a feature called Chart Share that allows, say, myself as a PCP to share a patient chart with you as the specialist real time, but what we'll be doing in the background is actually giving you a Practice Fusion account. Now, if you want, you can keep using the product, so we have continuity between us. If you don't want to do that, you can export it.
You have access.
Export it in CCR. You have access. You can export it in CCR, put it in your old legacy system, or you can just print it and put it to paper. But it causes this very viral, for lack of a better term in healthcare, method of helping us expand. But also, it really solves the main problem of interoperability in the space today. No one else can do it, and no one else does.
There's a number of ways of attacking that issue, but it seems like you've got a very interesting model.
Absolutely, yeah.
Ryan, let's go to the business model for a second. So obviously it's free. A lot of physicians want to know, is the company that I, if not invest their money, invest their time in, will be there tomorrow?
Sure.
If I can ask, are you profitable? How's the company doing?
So we're on break-even right now. We're in hardcore growth mode, so we're constantly spending a little more. So we're hiring about a few employees a week right now. So we're trying to really keep up with the demand of the system, but we do have significant revenue at this point. I think a lot of the other vendors are selling based on fear, and they have an inferior product. I can argue that all day long, but they might be like, a newer vendor isn't as secure. But for our specific case, we're funded by $1 billion company. We're also backed by Morgan Taylor Ventures. They're a $400 million fund in Palo Alto. So we have significant funding, major backers.
And if you've already got revenue, then there's sustainable
growth. We're in great shape.
Okay.
Absolutely.
Ryan, thank you very much.
Great, thank you so much.
Great chatting with you. This is Dr. Eric Fishman. We've been speaking with Ryan Howard, CEO of Practice Fusion. Thank you.